Hello, I'm Shelley Fritz from the Global Healthy Living Foundation. October 23rd is the inaugural Giant Cell Arteritis Awareness Day. It's a time to shine the light on this rare and serious condition. And today I'm honored to speak with Jenny, who lives with GCA in Florida. Jenny is an active senior who enjoys a good game of pickleball with friends. She's here to share her story about what it's like to live with GCA, the challenges, and the hope that she wants others to know. Welcome, Jenny.
Welcome. Thank you so much for having me.
It's such a pleasure to speak with you today. Thank you so much for taking time to talk with us. Can we start by you just telling us a little bit about yourself?
Yes, I am 86 years old, living in Florida after a life as a Foreign Service wife, living all over the world, mainly in Latin America and Africa. I was born and raised in Belgium, and at the age of 22, I had a Fulbright scholarship to study at the University of Pittsburgh, where I met my husband. Eventually, we married, and we are now retired in Naples, Florida. And we have 3 wonderful children, 8 great-grandchildren, and just a great family.
What a wonderful life you've led. It's so exciting, so full of adventure, and you've had so many experiences globally. It's just so fitting that you're here for GCA Awareness Day.
Oh, that's true. I didn't realize that. You're right. Yeah, it fits.
It's perfect. Can you share when you first realized something was wrong and what your journey to getting a GCA diagnosis was like?
Yes, it started, I think, 14 years ago when I woke up in the morning and from a very active person, literally could not get up. My aches and pains were in the back, in my ankles, in my knees. I knew something was wrong. That was actually diagnosed as PMR, polymyalgia rheumatica. And that's how it started. And then 4 years later, it started with the most horrendous headache. Literally, I thought my head was going to explode. I literally thought I was going to die. It was that bad of a headache. I drove myself to the doctor, insisted that I needed to be seen, although he said there was no room. I said, I am not leaving because if I do, I have to go to the ER. You need to help me. The physician assistant eventually received me, and she right away said, what you have is a giant cell arteritis. The symptoms are such, she felt that she could treat me right away without having to go through the biopsy. It's been 14 years with PMR and 10 years with GCA, and right now, basically, what I am managing it. I have to add that adding to my anxiety about GCA is that, strangely enough, my husband, 6 years ago, woke up in the morning and had lost the eyesight in one eye. No symptoms, nothing. He had the biopsy and it turned out he had GCA. So that dramatic event is kind of with me and I can't leave it behind. It's scary to think that you could wake up and have lost your eyesight in 1 or 2 eyes. So that's a very tough item that I have to deal with every day. And I had a flare-up a couple of weeks ago where I saw halos and I thought, oh gosh, there are the flashes that they're always asking me about. I got so scared because I thought for sure I was going to get blind. Turned out the halos were caused by dry eye. But that's the kind of fear that we live with constantly. It's the event that can really, either a stroke or blindness, that can just literally finish our lives. And it's just the not knowing and to be terrified that it could happen. And so to be constantly aware and on top of things to make sure that it doesn't happen. So that's the tough part of managing this.
Oh, wow. Yeah, thank you for sharing that so openly. How terrifying to feel like there's, the chance that you could wake up blind like your husband did. And that is a possibility with giant cell arteritis or GCA. It can cause severe eye damage and it's and can lead to blindness. It's also, unique that the two of you both have GCA and found each other and both ended up with this same diagnosis, but also have a similar experience with it. And that's the nature of this condition as well. So thank you for shedding light on your story of how it's been different for you and your husband, and how you are both patients, but also caring for each other. You're each other's caregivers as well. It's interesting to hear from your point of view, both living with the condition, but then also as a social worker, which your livelihood, right? So you have all that background and knowledge of what patients need. It makes me wonder, what has been most helpful from your healthcare providers in managing your GCA? So I'm kind of thinking about what else we could do, what other resources you might have wanted.
Well, here is a strange thing. I found my biggest help has been the physician's assistant. I find that the physician assistants have way more time to listen. They are the ones that are giving me the support, way more than any of the doctors. In our system right now, of medical system, Shelley, what are the doctors? 15 minutes, 20 minutes per patient? Whereas a physician assistant does have time to sit down and talk and tell me what pains have I had, what am I doing, am I hydrating enough, which is very important, which I have to learn, and that's helping a lot. Things that the doctor should have said, but just either doesn't have the time or the inclination to say. So that's my view of what I have experienced so far with the medical,
Yeah, I'm sorry that you've had a rough experience with doctors. And I certainly can understand, as someone with a different autoimmune condition, what it's like to have one of those brief appointments when you've been waiting for months to see this doctor, and then they come in and they seem like they don't have time for you. That does happen, and there are some things we can do as patients to try to at least try to get our most important questions in. Have you found that keeping a list of questions or tracking anything like your symptoms, has that been helpful for you in any way?
Oh, yes. Oh, yeah, absolutely. And I am very proactive for both my husband and myself. And my husband, by the way, had a flare-up with PMR now. And so he's under PMR treatment with the same doctor. So yes, we do keep, when does the pain occur? How does the 5 milligram work versus the 7 milligram? We do. I do have my questions ready right now to focus him and to make sure that I make the best use of his time. I do. And I think that is necessary.
That's wonderful. And, that helps. And sometimes, we can't control when they have too many people that they're trying to see, and our appointment feels rushed. But you brought up a really great idea, and that was to inform the other health professionals around that doctor even more, like the physician's assistant. That's a very interesting idea. I like that a lot. So GCA does affect people more who are older, it can affect people age 50 and older, but most likely 70 and older. And I think that jaw pain might be referred to as claudication, jaw claudication.
That's the word.
Yeah?
Correct. Yeah. Yeah.
So trouble chewing, having the jaw pain, and not just like a normal headache, like a headache, and then you would take your over-the-counter medication for it, or you try even a chronic migraine that's happening. That's something you should see your doctor about for sure. I don't want people to think just because they got a headache, they might have giant cell arteritis. But, if it's an abnormal headache that is very, very intense, you definitely need to talk to your doctor about it.
Exactly, Shelley. Hi, my name is Dr. Robert Popovian. I'm the Chief Science Policy Officer at the Global Healthy Living Foundation. I'm also a healthcare provider as a pharmacist. Listening to Jenny's story reminds us how much strength it takes to manage giant cell arteritis, or GCA. It's one of those conditions that truly deserves more visibility. Jenny, hearing you, how it affected you and your husband, and how you've continued to live such a full and meaningful life is definitely inspiring. The good news is that today patients have more treatment options than ever before. While drugs such as corticosteroids, like prednisone, are often used to control inflammation, newer medications, including biologics and targeted oral therapies, can help reduce dependence on steroids and better manage the condition over time. As always, if you or someone you know is living with GCA, talk with your physician about which treatment approach may be right for you. And this is exactly why awareness days like this matter for patients and providers.
So that brings us to why we're having GCA Awareness Day. if you could tell somebody why this is important, what would you say?
I think it's important for the patient himself or herself, but it's also important for the whole community to have their members be as healthy and independent living as long as possible. Good gracious, when everybody keeps on talking about the cost of healthcare in America, it's skyrocketing. It is going up again and again and again. Just to find people that can care for you is difficult and expensive. So, yes, if we want a healthy society, it starts by having healthy individual members. It's as simple as that. One healthy individual member after the other makes for a healthy group, makes for a healthy community, makes for a healthy society. And again, it's a win-win for everybody.
I agree. I think that's the theme. It's a win-win for everybody, and for everybody to try to bring awareness to what GCA is, how we can help people, and understand that it's not something that you just live with. It's something that you want to thrive with and find ways to live every day in the best way that you can. And so that's going to take some more education about it for the healthcare professionals, but then also for our communities, for senior communities everywhere, and for everyone who helps seniors at, living facilities and hospitals and doctors' offices, and everyone who interacts with seniors, to help them identify these symptoms and help them find treatment and know that there is some support out there and it's not something they just have to live with, and that should be expected. So what advice, or let's think about someone who just got diagnosed with giant cell arteritis. What message of hope would you share with them?
Oh, there is a lot. Here I've had it for 14 years, and to be honest, it's been 14 great years. It's been wonderful. I have basically not interrupted we've continued traveling. We have family reunions. The children come and visit. We go and visit them. We are going to diminish that mainly because of my husband who doesn't want to travel anymore. I used to play tennis. I play pickleball several times a week. The big hope is, yes, it can be managed. But when I say yes, it can be managed, that also requires the effort, right? When you say you manage it, you have to look at, okay, what are the things that I can do? What are the things that I should do? And what are the things that I should not do? So you really have to take stock of all those things that impact this condition, and then literally sit down and decide, okay, yes, I want to continue living well. I can manage this. I'm going to do it. Manage means being actively involved in what you do and don't do. It takes an effort.
So it takes effort. Managing your health means being actively involved and aware of how you're living your life every day and trying to make the best decisions.
Sometimes I think, well, is it helpful to spend time on the negative and just try to manage it as well as can? I don't know. I don't know the answer to that. Is it better I think you need to be aware of it, but I don't want people to spend too much time on something that may never happen. Instead, spend some time on managing that over which you have control. You know what I'm saying?
I do. That's a really good point. I believe the mindset is really important in determining, how good you feel sometimes too. So it's important to stay positive but realistic, and, make sure you stay on top of any changing symptoms. You stay in touch with your healthcare team and stay active like you are. Thank you so much, Jenny, for taking time.
Thank you, Shelley, for allowing me to share my story. I really appreciate it.
Well, Jenny, thank you so much for sharing your powerful story with us. By raising awareness, we can help more people recognize the signs of GCA sooner and encourage healthcare providers, the whole team, to better support people like you living with this condition. And on GCA Awareness Day and every day, we stand with the GCA community.